For this very general learning session, we have 5 objectives. And the objectives for each learning session will be things that you should be able to do at the end of the case. So they're achievements, they're accomplishments for you, not something like understand the skeleton. So the 5 objectives for the introductory bone session are, first, at the end of the session you'll be able to define the term skeleton. It's a term that we use all the time, but anatomically, strictly, what does it mean? The second learning objective is that you'll be able to explain the difference between the axial skeleton and the appendicular skeleton. The third objective is that you will be able to explain which bones of the skeleton are single bones and which bones are elements as part of a series. The fourth objective is to describe the similarities between the organization of the upper limb and the organization of the lower limb. So wherever possible, again, we're going to stick to basic rules and learn one, get one free. The fifth objective is to describe the 3 basic regions of a long bone. Most of the bones that we'll be concentrating on as we go through the cases will be the bones of the appendicular skeleton, and those are long bones, so that will be a useful general exercise. So a brief vocabulary exercise, only 2 vocabulary words for this section. The first vocabulary word is the term girdle, and that is derived from the Latin cingulum, which is a belt or support. The second vocabulary term for you to learn for this session is the term articulation, which means a joint. It's just a fancy Latin name for a joint. But the Latin itself means a formation of vines. So the 2 vocabulary words are girdle and articulation. The skeleton is actually defined as all the bones of the body, and if we include the tiny little bones in the middle ear, there are 214 bones in the body. In vertebrates, like ourselves, we have an endoskeleton, which means that the bones are not at the surface of the body, but the pattern in insects and crustaceans is to have an exoskeleton, which means that the bones will be on the outside. So the bones of the axial skeleton are the central bones of the head, the neck, and the trunk, and the bones included in the axial skeleton will be the skull, and the blue areas that you're seeing on these slides are, wherever possible, I just added the connective tissue structures and cartilage structures, so you'll see some nice big ears on the skeleton because they're made of cartilage. So the first bone will be the skull. The second bone will be articulating or attaching at a joint to the skull, and that will be the mandible. But right beneath the mandible, if you put your hand just under the front part of your mandible and then swallow, you'll feel a bone right there at the base of your tongue, which is the hyoid bone. So that's a bone that many of you probably didn't even know you had, but it's a useful bone because it gives form to the tongue and helps the floor of the mouth go up and down when you swallow. The organ that I'm using to talk to you right now is actually the larynx, which is both a valve for the respiratory system and the organ of speech. And that is like a little cartilage skeleton with synovial joints and with muscles attached to it. And that's right here in your throat, right below the hyoid bone. So it isn't bone, but it's actually part of the musculoskeletal system. The larynx as a valve is right on the top of the trachea. The tracheal cartilages are here. The skull in the axial skeleton is sitting on top of the vertebral column, and that's easier to see from the back. So if we look at the vertebral column from the back, we'll see a series of vertebrae in the vertebral column, and they're organized into regions with slight differences in the anatomy of the bones because of slight differences in function. The most superior series in the vertebral column are the cervical vertebrae, and the term cervix means neck. So there are 7 cervical vertebrae, 1 actually holding up the skull, and that's the atlas vertebra. So in mythology, Atlas was holding up the weight of the world on his shoulders. And then right beneath that is the axis vertebra, which enables the head to pivot. So we teach the first year medical students that the joint between the skull and the atlas vertebra is the yes joint. because it enables you to flex and extend your neck. And the joint between the atlas vertebra and the axis vertebra is the no joint because it enables you to shake your head. 7 cervical vertebrae, and the last cervical vertebra, which is C7, will articulate with the first thoracic vertebra. There are 12 thoracic vertebrae in humans. Different mammals have different numbers. And the characteristic feature of the thoracic vertebrae is that they articulate with ribs. So the thoracic vertebrae articulate with the 12 ribs. Right below that are the lumbar vertebrae, and if you look at this series, you can see that as we go from superiorly right below the skull to just above the sacrum at the lumbar vertebrae, the dimensions of the vertebrae are getting bigger. So the lumbar vertebrae will be much wider and deeper than the cervical vertebrae because a greater percentage of the body weight is being transmitted through them. The lumbar spine has no articulations with the ribs. Occasionally, some people will have a lumbar rib, just as some people will occasionally have a cervical rib, but that's an unusual variation. At the inferior extent of the lumbar vertebrae, the 5th lumbar vertebra will articulate with the sacrum, and there's a curvature right at that articulation, and so that's a weak joint. So you may have heard of, or you may even have yourself, some lower back pain, and that's because it's a sharply angled joint and there's strain on the intervertebral discs, which are what you can see illustrated in blue. So 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. Lumbar vertebrae articulate with the sacrum, and the sacrum itself consists of 5 vertebrae which are fused. At the end of the tip of the sacrum are a variable number of coccygeal vertebrae, which is all that we have left of our tails. So many mammals have long, beautiful, useful tails. We only have a little short one, which is far less useful. Looking again at the front, we know that the thoracic vertebrae attach to the ribs, and in the front there is a bone which again in the embryo fused from many small different parts, but in us it's fused to form the sternum. And so the sternum is also the breastbone, and the 12 pairs of ribs attach to the vertebrae posteriorly and to the sternum anteriorly. Between the ribs and the sternum are bars of cartilage, which are very soft and compliant in younger Anatomy X students, but which may have started to calcify in older Harvard X students and myself. So those are the bones of the axioskeleton, and here's a quick quiz question.